Everybody, this is Congressman Mark Alford working hard in the 4th Congressional District during the Schumer shutdown. We're on day 21 now. Listen, I hate this shutdown, but it's really given me the opportunity to come to places like the Royal Oaks Hospital, part of the Compass Health Network. We are in Windsor, Missouri, a small little town in Henry County. I used to go to the cattle auction here actually with my brother-in-law. Today we're visiting with the staff here at this great facility. This is one of the only treatment facilities for behavioral mental health for adolescents and children. Kids from all over the state of Missouri come here in kind of an acute mental health crisis situations, and they are treated here. And we got a chance to talk to the staff, and I want you to hear from the CEO of one of the biggest issues now facing children when it comes to mental health.
So I think, one of the things that we always have to recognize in mental health, behavioral health, is what is the home environment of those children and how can we engage with them, particularly around issues with social media and kids' access to so many different things that they weren't able to access before. I think those issues probably are around access to care. We need to try to do what we can to ensure kids have access to care, access to medications, and really try to help the entire family, looking at what their needs are and trying to be supportive of all the community services and case management that we can provide to ensure that these kids are getting to the right levels of care and following up with treatment plans that they have.
The problem in mental health and its treatment is not just with children. In the state of Missouri in the last 20, 30 years, they have gone from 14,000 beds for those with mental health issues and in mental hospitals down to 2,400 beds. Mental health is a huge, huge issue here in Missouri, and we're trying to follow in the footsteps of Senator Roy Blunt, who is so big on helping with mental health issues. And this visit, once again, while I hate shutdowns, it really gave me the opportunity to listen and to know what we can do. One of the things we're working on is, the president issued an executive order for H-1B visas, now charging people from coming outside the country with specialties like doctors and nurses and other high technical areas, charging them $100,000 to come here on an H-1B visa. We have written a letter to the Secretary of Homeland Security, Nome, to have a waiver for rural hospitals like this one, because it would mean that they could not get the healthcare professionals, the psychiatric doctors here at this hospital if they had to pay $100,000. So that's one of the things we're working on. I'm Mark Alford, your vote and your voice in Washington.